This episode is a partnership with the European Union Civil Protection and Humanitarian Aid. Olá, só para avisar que este é um episódio em inglês, uma conversa bem interessante sobre o estado da ajuda humanitária no mundo hoje em dia e sobre o papel da União Europeia. Até já. Hello, my name is José Maria Pimentel. Welcome to 45 Graus. Did you know that the European Union is playing an increasingly pivotal role in the global response to humanitarian crises? That is precisely the topic of today's episode, with a focus on what the EU is doing on health assistance throughout the world. Our guest today is Ian van Engelgem, who is a health advisor with DG ECHO, the EU's Department for Civil Protection and Humanitarian Aid Operations. Ian is currently working based in the regional center in Dakar, Senegal, where he draws from a wealth of experience in humanitarian health aid. He began his career as an emergency ward doctor in Belgium, before moving to Guinea with the Doctors Without Borders, where he provided vital medical assistance to refugees from the Sierra Leone conflict. Since then, he has worked across countries like Afghanistan, Cambodia and Kenya, with a focus on providing healthcare to displaced population and controlling disease outbreaks. He currently advises on health and nutrition policies, guiding the EU's humanitarian aid during crises. In our conversation, Ian highlights the growing need for humanitarian aid in today's world. He explains the EU's role through institutions like DG ECHO in both helping through funding and directly intervening in crises, describing the scope of the EU's operations from its budget size to the main countries currently receiving aid. We explored the different mechanisms that the EU currently has to assist countries facing situations ranging from conflicts to disease outbreaks, such as the COVID pandemic or the 2014 Ebola epidemic. We also discussed some of the main regions and countries the EU is helping today, such as the Democratic Republic of Congo, DRC, a country grappling with both conflict and ongoing disease outbreaks, such as the current MPox epidemic, which the World Health Organization, as recently as August, classified as a public health emergency of international concern. A key focus of our conversation is in the EU's health assistance, and we discussed, for instance, how previously overlooked aspects like mental health are now finally receiving a greater attention. And towards the end of the conversation, Ian also shares his insights into how humanitarian aid will evolve and what we can expect from the EU operations in the future. For our Portuguese-speaking listeners, you might recall my recent episode with João Silva, also from DG ECHO, where we discussed the EU's civil protection efforts in fighting natural disasters ranging from wildfires to floods. In today's episode, I found it therefore particularly interesting to explore how the EU's humanitarian aid complements and expands on its civil protection work, and I hope you'll find it just as enlightening. And now I give you Ian van Engelgem. Ian, welcome to 45 Graus. Very nice to have you here.
Thank you very much for having me.
How are things in Dakar?
It's quite hot as usual, a little bit rainy these days. It's the winter is approaching.
A lot of activity.
Yeah, indeed. Not so much in Senegal, but in the countries we are covering from this office here.
Yeah, because you cover a wide area, right? How far does it go? Like, what's the radius, as it were?
So the office here, it's a regional office that provides support to our country offices, which are in several countries in West Africa where there is conflict, the Mali and Burkina Faso and others. And then up to the more Central African Republic, Nigeria, Cameroon, Chad, and so on. So that's the radius a little bit.
Mm-hmm. How many offices are there in total?
In total here, I think we're about 10 or 12 or something in the region. In total, there are in the world about 40, I think, for DG ECHO.
40. Okay, interesting. Yeah, that's a lot. Okay, let's talk about EU humanitarian aid. So that's the main topic of this episode, and then within it, the health assistance side. But to start with the overall picture of what the EU does in terms of humanitarian aid, and actually maybe this is kind of a basic question, but it's better to take a step back and start with the original question, which is the why. Like, why does the EU need to act on this front? How big are the humanitarian needs in the world nowadays?
As you probably know, conflicts, which are the main cause of humanitarian needs, humanitarian crises, haven't receded much over the past years. Huh? They keep on increasing, especially
I like your euphemism. They haven't receded much.
Especially here in the region, we have the whole Sahel region, which was quite calm. There was no conflicts. There were huge problems of malnutrition in the past, which we addressed considerably. But then, the conflicts did spread from Niger, Nigeria. The whole West Africa region is in quite some turmoil. So in total, we have hundreds of millions of people that are in humanitarian needs in the world. Keeps on increasing every year, and so do the financial needs increasing. But the financial contributions, the financial means that are spent on it, they increase too, but not up to the level that the needs are increasing. So we continue to have a widening gap of needs.
And do the needs increase because the world is getting worse, or because we're also like lowering the threshold for intervention?
No, I don't think we are lowering the threshold. I think what we are witnessing is a real increase of basic needs that people have difficulties of surviving, and there is an increase in the violence, but also due to issues like climate change, the floodings that we currently have in the West African region. Millions of people are affected. So then the issue of climate change and disease outbreaks.
So you mentioned that this increasing trend has to do with conflicts, but also diseases, also effects of climate change. Like, do you have an idea of whether they're all contributing to this increasing trend, or some of them are actually decreasing, so there are opposing trends? For instance, I would imagine that in terms of diseases, the trend would be more positive than conflicts in this century, at least, I'd say.
Yeah, what we see often is that those crises converge and they result in what we call in our sector, in the humanitarian aid, complex crises, where you have an increased risk for disease outbreaks because of conflict and displacement of populations, more vulnerable populations because of lack of basic services, worse health status and health services access. And so whenever there are natural disasters or epidemics, the impact of those events becomes much bigger. So
yeah, that's an important point you're making. I think it's so these situations tend to reinforce each other, kind of in a vicious circle, right? So if you have a conflict, that will tend to make it more likely that you have an epidemic, say. And the same thing goes for a natural disaster caused by climate change, right? So when things take turn for the worse, they tend to reinforce each other, right?
Yeah, indeed.
Yeah. And that's a big challenge. One thing I'm curious about is, how do you define whether a country is in a humanitarian situation or not? So what's the method to define that threshold that then will lead you and other, of course, international organizations to intervene?
We will provide humanitarian aid when there is the mortality or disease patterns or security is increasing up to a level that it impacts or it exceeds what is normal, and also where the country itself cannot or they don't want to provide the needed support to bridge these gaps to come back to a normal situation. So it's not always clear-cut, this definition, but it's a combination of factors where especially the risk to unsafe living conditions and safety and dignity that will define whether we will intervene in a context that we then define as humanitarian.
Okay, so we've established that there's a growing need for humanitarian aid in the world. And this helps to some extent explain why the EU has a role here. But maybe I'll wager that for the listener, that's not completely clear cut. So we easily see why the UN, for instance, has a role here. But for an institution which is mainly a political institution uniting European countries such as the EU, that's not so clear. So how would you explain the rationale, so the reason for the EU to intervene in terms of humanitarian aid, and not, for instance, for the individual countries or even their individual citizens in Europe to do it through multilateral organizations such as the UN or, I don't know, or the Red Cross or whatever?
The EU started with humanitarian aid services back in the 90s. It was to show solidarity to affected population, to provide relief to victims of the disasters and so on. Separate member states, many countries deliver humanitarian aid, and they will most often function as a donor. They will give money to the UN, to NGOs, or to the Red Cross to provide assistance. The countries themselves most often don't provide direct assistance. It's mainly through funding towards specialized agencies. So yeah, for the EU, we have in the Lisbon Treaty, it's written that we commit to providing this assistance. We have been doing that since the 90s. And yeah, we are working together also with our EU member states, and we are the biggest humanitarian donor. So it's a key pillar of the EU external assistance, where we also try to respond to, of course, to the main needs, but also in a way that shows a little bit the values of what the EU and the EU member states stand for.
But why don't the member states do that independently, so by themselves? So what's the benefit from an outside observer of having it done centrally, as it were, by the EU bodies? DG ECHO in this case. Yeah.
I think DG ECHO is recognized as a reference donor. We have several comparative advantages to the individual member states. We have a huge policy and capacity, but we have also the operational capacities on the ground. So we have all the offices in the countries with the main crises. We have humanitarian experts working on the ground to work with the population, with our implementing partners, to try to offer the main services and the main support to people in distress. And we are working together with EU member states, but also with the US and other main donors to coordinate. And we are quite proud of what we developed at EU level, this really specialized organization, which is DG ECHO, to inform also and to help others to better target humanitarian aid.
Yeah, and there are probably benefits to scale, right? So that you're doing this at the level of the EU means that you're able to pool resources from different countries, have a structure that wouldn't structure in terms of personnel also, right? In terms of the number of people working that you wouldn't have in individual countries alone. You have a single point of entry probably in terms of contact with other organizations. So there's a lot of benefit there of making the EU countries act through the EU institutions, right?
Yeah, and I think these days it's also at the more broader level. The EU with the EU member states try to do also in development and other sectors. We try to do things more and better together in what we call a Team Europe approach. That's a little bit of the vision, I think, for that. One day we'll all merge together in a perfect way. And
yeah, how does it work in practice? So, where is EU humanitarian aid present nowadays? How much funding is there? How does it work in practice in terms of you doing it directly or through funding other organizations? So, how does the whole thing work?
Okay, so we receive like 1% of the EU budget. We're not a very big Directorate General. Okay, there is also some funding for the civil protection side, but that's also not that important yet if you compare it with the total EU budget.
So 1% is just the humanitarian aid side.
Yeah. So it's like €3 per person per year for the EU as a whole.
That's a good figure. That's nice to know. Yeah,
it's not a lot.
It's not a lot, no.
And so, most of our money goes to our implementing partners. As I said, it's the UN system, the Red Cross system, or
NGOs,
international NGOs with the bases in Europe. So aside that, we have the field network of 140 international experts like myself, trying to guide better this money given to partners to make sure it's according to the needs and is responding to those most in need.
So you act as a sort of consultant locally?
We try to make sure that the European taxpayer money is used as good as possible.
Yeah, that it doesn't work only on paper, but actually in reality, right?
We make sure that every action we see also in real what is going on. We go to visit these places and whenever possible, because with increased insecurity and it's become also more and more difficult. But okay, we still reach out to the populations and go to see ourselves. And then, we have also other capacities at the EU level, which is more recent to some extent, I would say, to assist our partners in doing their job. So we have since very long what we used to call the Eco Flight. It's air service that we fund for our partners so they can fly to the most remote places. We do also deliveries by what is called a Humanitarian Air Bridge, where we bring in medicines or other goods from Europe or from other places to humanitarian crisis setting. Also, with our colleagues of civil protection, some 10, 12, 14 years ago, we merged the civil protection with the humanitarian aid. And so more and more we are blending. We're trying to use a little bit the philosophy of civil protection, I would say, more as a doer, what is now like a slogan, ECHO as a doer, but that where we can also send emergency medical teams that are specialized teams from Europe that then can be sent to disasters or to crisis settings, and mobile laboratories to be sent to outbreaks and so on. And so there are some interesting shifts, I think, that make us even better adapted for what we have to do in crisis settings.
Yeah, interesting. So although most of what you do nowadays is still through funding and not acting directly, increasingly there you also do kind of supporting roles and also direct interventions through the civil protection side, right?
Civil protection or humanitarian aid, I don't think there is for what we call the EU humanitarian response capacity. Is it civil protection? Is it humanitarian aid? It's somewhere in between, and it's not important. But it's I think, and the spirit of developing this, it came from the outbreaks. Some of it from the disease outbreaks, also to bring in other EU expert capacities. So it's in between, I think, and it's a good thing that we are trying to look for new approaches and be more effective.
Yeah, absolutely. And actually, for those who listened to the episode with João Silva, which was precisely on the civil protection side, it's one of the things that he mentioned, that there's an increasing overlap between the two. So in practice, in many situations, it doesn't really matter whether it's the civil protection or humanitarian aid side working out, because many situations tend to be like a mix of these, and the challenge tends to be on both camps.
Still the difference is that as humanitarian crises are often in conflict settings, then civil protection needs to work through the humanitarian principles also. We have to be careful that we go in the right direction.
Yeah, it's not always as simple as a natural disaster. Simple between
humanitarian
the metaphorical
aid,
sense. Yeah.
Humanitarian aid, it's complex, and it's becoming more complex also because of more insecurity and these non-state armed groups. And when I started in the late 90s, a humanitarian career, we had some internal conflicts, but these international non-state armed groups like ISIS and others are unheard of. And there is really an increasing disrespect also for the rules of war and the international humanitarian law, which makes attacks on health services, on healthcare workers, on schools and all that. There is no more rule or order in humanitarian aid, and respect of the humanitarian principles. I think many of these groups, they don't care, and there's still a big work to do, which also ECHO is through advocacy and through field work, through organizations like ICRC and others to work on this IHL. That's a main challenge still.
Sorry, Ian, please explain those acronyms you just used.
So the International Humanitarian Law, IHL, sorry.
It's not only that the situations are graver, but also the work of a humanitarian aid front person is more complicated and more challenging than in the past.
Yeah, I think it's more risky.
More risky, yes, more risky. Challenging. I was using an euphemism, but yeah.
But yeah, we have to, as a humanitarian, you have an obligation towards people in need, and you have to find ways of dealing with it or trying to reach people differently. And I think with our cash, which is now a main trend in humanitarian aid since a few years, we can do things differently, but not everything can be done through cash. And that's, you need to delivering services where you cannot pay for people to go to services like healthcare when there are no services, or when they are overwhelmed, you need to intervene differently. And that's...
Yeah, if there's no basic infrastructure, funding alone will not solve it, especially will not solve it in the short term. Just so that people get a concrete picture of what the EU is doing in different fronts. Nowadays, what are the main destinations for funding? Like what countries nowadays are, if we were looking at the map, like, you know, those bubble graphs in which the larger the bubble, the larger the funding, like which spots would there be where the biggest amount of funding would be going to?
I think it hasn't changed a lot, although, with Ukraine, that's now a main country where we put our money. But for the others, most of it is in Africa still. And there we have the big crises like DRC, which has been escalating.
Democratic Republic of Congo.
Yeah.
I have to keep translating your acronyms. Come on.
That's kind of typical for humanitarian aid, and we are often reminded
for
of it.
Any job. It's just that the outsiders don't know.
Democratic Republic of Congo, the Ethiopia, the Somalia, Syria, Afghanistan. Those are still some of the main recipients of humanitarian aid.
And these are situations, if I understand correctly, some of them are disease outbreaks, such as DRC, right, the Democratic Republic of Congo, whereas others are more situations of conflicts, and in some cases, probably both.
Often it's both, but DRC, it's a long-standing conflict. It's a long-standing humanitarian crisis. Since the Rwanda genocide, it continued to suffer and to degrade up till the moment now, where we have millions of people around Goma in embarrassing, incredibly poor living conditions. It's horrible, and it's getting worse. So yes, there is the disease outbreak now in DRC, the MPox outbreak, and we have the high impact disease outbreaks in previous years, the Ebola and so on. But the main needs in Congo remain the displacement, where people living under a plastic sheeting, living in shacks, barefoot children, and then getting sick from malaria and so on. But often these are breeding grounds also, for disease outbreaks that will spread. For instance, the cholera, it's been, we are still in the seventh pandemic of cholera. We never stopped since it was declared. It's the biggest the longest standing pandemic. So in Congo, we have thousands of cases and hundreds of deaths every year. And then places like Syria, Afghanistan, also it's a lot displacement, and that's main, and displacement continues to grow. The number of people that are displaced reached a new summit. It's millions of displaced, and that's the main humanitarian crisis. But then, as I said, yes, you have high risks of disease outbreaks in these living conditions, in these overcrowded places, lack of services and so on. And so you have to invest in prevention of disease outbreaks getting out of control, which can sometimes go very fast. In refugee camps in the past, the people would die like flies because of Shigella outbreaks, meningitis outbreaks. And so we have to continue to invest in preventive measures, make sure that the water is also safe and so on. It's not only the health sector.
Yeah, of course. Yeah, it's a multi-factorial intervention.
Humanitarian aid is multi-sectoral, and so we have to take care of all. But so, the disease outbreaks, that's also part of it.
Yeah, because as we discussed before, these things reinforce each other, right? So you have a conflict, then you have displacement, then you have poor sanitary conditions, then you have diseases, but then you don't have the health system to fight the diseases. So it's a challenge that keeps on growing, like, in a sense.
Yeah, WHO estimates that 70% of disease outbreaks worldwide are in fragile and conflict-affected settings. So
yeah, that's a big number. And you work specifically in the health assistance, right? Within the overall EU Humanitarian Aid, you work on the health assistance side. What does that mean in practice? Like, what other types of assistance are there? And is there, and I guess not, a direct correspondence between health assistance and cases of disease outbreak, or not all health assistance goes to specifically fighting disease? And I imagine not, because part of it will have to do with, again, creating the necessary infrastructure, which can be in a conflict situation and not necessarily in a disease outbreak, right?
So I'm a doctor by training, and so I cover the health and nutritional aspects of humanitarian aid in DG ECHO for countries of the region here. So I'm giving a technical recommendation. I will go and visit now next week projects in the northeastern of Nigeria to see that those are implemented, quite specialized humanitarian aid, delivering health services, making sure that pregnant women get prenatal care that is of acceptable quality to prevent congenital syphilis and whatever, which is it still gives me the creeps whenever I see those things happening. So we have to make sure that the quality of our assistance is good to the norms and standards that we want to achieve according to our policies. Also on the nutrition, the same, to see that nutrition is a huge problem in humanitarian crisis settings, and a lot of malnourished children still are dying also because of malnutrition, and that's not because of the malnutrition, but malnutrition contributes. So we have to make sure that those children get out of the risk for morbidity and mortality. But so outside of the health and nutrition, so yeah, the main funding is still going, rightly so, to the food assistance, food security, and livelihoods assistance. That's according to the latest data, it's like 37% of our funding will go to that.
What does that mean, livelihood? It's like houses?
No, the houses, that's another issue. It's what people do to have an income, to keep cattle or to feed themselves. What are they doing to feed themselves? So we give food, but yeah, we also help people to make sure they can have food and can have also means to live a dignified life. So health is usually the second sector, and again, yeah, in certain crises, it will shift. These proportions will shift a little bit, like in outbreaks. When there is a huge outbreak, majority of funding will, of course, go to health, and then the others. And then I think protection is a little bit the same amount of funding as health. And then there is the water, the sanitation, the shelter, the education, etc. So in the healthcare, more specifically, it's about, as I said, delivering services, but also making sure that disease outbreaks are not occurring, that other public health risks are not popping up.
If I understand correctly, there are different types of situations. So you might be intervening in a situation of conflict or in a situation of a disease outbreak. And in each of these situations, you will typically act through all these different functions or all these different goals that you just enumerated. So it can be food, it can be livelihood, housing, health, sanitation. But the proportions of those will vary between different challenges. And so, as you said, if there's a disease outbreak, it will be more the weight of the health aspect, which is the one you're working, would be heavier. Whereas if it's a conflict, it will tend to be lower, but it will be still there, right, in each of those situations.
Yeah, I think what we, for instance, learned in disease outbreaks, the Ebola West Africa 2014-2016 outbreak, which affected several countries in West Africa, and then also spread to a few cases in Europe and the US. But also the other Ebola outbreaks in Congo, the COVID, and so on, is the multi-sectoral nature of disease outbreaks. It's like other crises, other humanitarian crises. You have to respond through different approaches. For instance, what we learned and the hard way at sometimes with disease outbreaks is that we need to focus a lot on communities. They say now that outbreaks, they start in communities and they end in communities. And I think where we had previously a more health and biomedical approach to disease outbreaks, we learned a lot over the past years to see from a more empathic way, from a protection angle and so on, and to make sure that people that the care that we propose, that it's also that it's acceptable for them, that it's according to their traditions, to their beliefs, and so on. Without, of course, losing track of the main goal of providing care and preventing the disease to spread. We have to, like in humanitarian aid, I think we learned a lot from how we did humanitarian aid in the northern Kivu province in eastern Congo during the Ebola outbreak in 2018. We learned a lot from the humanitarian actions that were conducted since years there, how to put better people at the center of action, so at the center of the problem.
That's interesting what you're saying, because it means that there's still a learning process going on in terms of humanitarian aid, and things that might be correctly thought in terms of policy will not necessarily work out if you don't think of the practical aspects, such as the people, such as how the communities work in which those policies will be implemented, right? And if those conditions are not there, in the end, it will not work out, even if it's very correctly devised, right?
Yeah. And as is the case in other businesses or sectors, or we are learning every day. We are adapting our approaches, and there too, I think from the work we have been doing in disease outbreaks, it has been an interesting journey to see how we can do more and better in disease outbreaks outside of Europe, bringing in specialized capacities from EU member states. Then I think ECHO has an essential role to play there, to also make sure that whenever these outbreaks are in humanitarian settings or they have humanitarian consequences, that we try to coordinate as best as possible with whatever we can bring and what is useful that is available in the EU. We are seeing now also with the MPox in DRC. So EU Health Preparedness and Response Authority, HERA, they managed to bring in vaccines, MPox vaccines. So I think, again, this is a capacity that the EU developed, a capacity meaning a Director General, HERA, that is intended, first of all, to respond to disease outbreaks inside the EU, but also outside the EU. And so they will procure vaccines for Europe, but in case there is need to suppress quickly an outbreak elsewhere, we have an obligation, I think, to react and to respond, and that's what we are doing, and that's what we also did in the past with the European Centers for Disease Control. So there are high-level experts, epidemiologists, and other technicians that can and have contributed to controlling disease outbreaks in the different Ebola outbreaks, and now also the MPox. And I think this is really what makes us stronger, a more credible actor as the EU. When it considers the global health security, I think we come from a long way. It used to be mainly in the West Africa Ebola outbreak. I think what the US managed to do there flabbergasted us all. But we reacted, EU reacted also because of the COVID and other threats inside Europe. But we managed also to bring those capacities outside the Europe and to show that it's of interest for the EU, but we also show solidarity, and we know that it's necessary to prevent global spread of these outbreaks. And I think that's a very nice journey that we went through since the 2014 outbreak, at least for me, how to see this evolution of how the EU is building up coordination, capacities, structures to really take these things serious.
Yeah, it's very interesting what you're saying, because it's not only the funding that matters, but also the way the organization. And in this case, it's interesting because I don't think many people know, at least I didn't know, that the EU had gained this role in recent years, which again goes beyond funding, of having the organization and the capacity to intervene in these situations and to plan ahead, as you were saying. So these situations are relevant for Europe and for European citizens, because these outbreaks can then become pandemics ultimately. So it's a smart policy, but that requires organization and a certain capacity. So I don't think many people know that.
Yeah, and if I see the MPox today, so we have been funding MPox interventions with research institution and with an implementing agency in Eastern Congo since 2022, and because the mortality, it's way higher than what it has been with the 2022 outbreak in the pandemic, the MPox pandemic in Europe. People are dying at a tenfold rate or higher compared to Europe, because capacities are weak, and standard treatment for such cases in Europe, you can't compare it with what they get in Africa. And although we are doing already a lot, I think, with our partners, trying to provide the best, but we can do more, and we should do more. I think we have capacities in Europe, and like the emergency medical teams, which could be deployed for certain cases and have been deployed for cholera and for those things. But there again, it's a little bit as it is a conflict setting, and that's the risks are high, and to bring in specialized people, it's a challenge. But maybe it's also a good call for young doctors to think also about doing some intervention whenever possible to see what you can do. You don't need to do your half of your life like I have been doing it myself, but we can bring capacities and build up capacities, which is even more important probably in those countries which have very little means, very little qualified staff and so on.
What's your view on the MPox epidemic specifically? Because I don't know if people who are listening to this know that, but WHO, so the World Health Organization, declared the epidemic just in August, so very recently, as a public health emergency of international concern, which is a term I've never seen before, but it does sound grave. So, and of course, there are some news of this in Europe, all the way back since it began in Africa, in the DRC, I think. But the situation seems tougher now, right? So it's like a big concern. It's probably the biggest challenge in terms of humanitarian intervention nowadays, right?
I wouldn't say in terms of humanitarian intervention. We can't compare what the suffering that people have in the rest of DRC, especially the East, in Afghanistan.
In terms of disease control,
in terms of diseases, it's the number one today. But it's a very quick spread these days in the eastern part, in the southern Kivu part of Congo, which is fueled by the total breakdown of services of society, of the decades of conflict and misery. And so, this disease has been spreading through and around mining places, the carrière, what they call in Congo, so where they go and dig the stuff for our cell phones and but also other materials. But so there's a lot of promiscuity in these places. These people live from day to day there, and when they find some gold or some whatever, they will use it, maybe not in the best way, and there's a lot of commercial sex work and then it has been really booming there. Nobody has the full picture of why and what. There is it seems to be that this virus, which is split off from the virus that has been in Congo for decades, and called the Clade 1A, which is nothing, which is different from the one we had in Europe. But it seems to be more transmittable through sexual contact, but also the living conditions. A lot of children in Africa, and then children they play together. It's not like in Europe where they sit behind their computer or they still have a lot of physical contact. So you have different circumstances that makes that this spread has been exponential there. It has spread also to Burundi, quite importantly, more around the capital, which is not far away from the epicenter. Uganda seems also that there is and has more and more cases, but we are talking about a handful of cases still. Detected what is the real spread that's still difficult to know, but that's also seems to be through long distance truck drivers, sex workers, a little bit like we have seen spread of HIV, that's sexual transmitted diseases. But how big is the threat for Europe and for the rest of Africa? Difficult to say, but I think what we have seen with this outbreak is that it's a fragile, conflict affected country, and also in Uganda you have a lot of refugees that from Congo. So it's really what we sometimes call a perfect storm, where you have different conditions together that makes that it explodes. We have this case in Thailand, the case in Sweden. I don't think that we can have such a perfect storm in our countries. It's a completely different setting, and also education and all that. And communication means it's all very different. And so, but let's see. I remember during the 2014 Ebola outbreak when I was in Guinea and I saw the last patient coming out of the treatment center in the epicenter, and I said, it seems to be done now. It seems to be finished. And then 3 months later, it exploded completely. So who knows?
And because also of under measurement, right? So the fact that under diagnosis, so
and especially
sometimes you don't really know.
Especially with sexually transmitted diseases, I think there is still a big. It stays underground often more in Africa than in Europe, also in Europe and in other places. But you can't openly talk about those things as we do in Europe. I think it's especially then when it concerns men having sex with men or other groups, then it's completely out of the question. And let's hope it's not gonna spread through these groups, but probably it is, and those people will have it very difficult of getting care, because the most important still is to make sure that people can be accessing healthcare and don't have to hide and and suffer meaningless.
Yeah, again, what you're saying underscores your previous point that the practical challenges and the human challenges are often bigger than the pure medical or even logistical challenge, right? So even the way local society is configured can bring a big challenge to a situation. Let's go back to health assistance in general. I wanted to close the overview that we were doing 20 minutes ago. I don't know how long. So if I understand correctly, you have, in terms of health interventions, you can intervene in epidemics such as MPox, for instance, and it can be through treatment or vaccination or whatever. You can intervene through helping set up primary healthcare systems in these countries so that they are able to have proper health and even in a better position to fight these diseases. And then you also intervene, and this one surprised me in a positive sense. You also intervene in terms of mental health and psychosocial support. And that's interesting because it's often an overlooked dimension. But I mentioned specifically in conflict situations, it shouldn't really be overlooked because it's probably a very big thing. Like if you go through a conflict, the amount of, I don't know, PTSD and whatnot. Well, this time it was me using an acronym.
Indeed, so I wanted to correct you.
My bad. Post-traumatic stress disorder and I mean other consequences. I mean that should be big. So it makes a lot of sense that you intervene also through this front.
Yeah. So in the conflict settings, the humanitarian crisis settings, in camps and displacement settings, so we try to provide a basic package of healthcare, and mental health is part of it, although it has been gone unrecognized for very long, I think. Yeah? I think also in Europe, mental health is still sometimes taboo to go to a psychiatrist, like psychologist. But in the conflict settings, everybody is exposed to violence and to undignified living conditions. And so it's estimated that 1 in 5 will go towards things of depression and anxiety syndromes. And so the caseload is extremely huge. But in most of these countries, mental health was never developed also. I think in Africa, we had a transition since decolonization, but in the colonial times, infectious diseases was the important issue. We have been seeing in Africa now all those, what we call the epidemiological transition. We have more and more mental health, but also the non-communicable disease, cardiovascular, it's a main mortality now and then. But although we have this transition also, and the needs in conflicts and humanitarian crises are extremely huge, the health systems in many of the countries we work in have not prioritized it, the mental health. And I was recently in Chad. There is one psychiatrist for the whole country. So, well, in Nigeria, it seems to be a little bit better. There are 200 million, so they have 300. It's also... But that's the main...
Suddenly it sounds a lot.
That's the main difficulty on developing these aspects of mental health. And so mental health is also, you can do, there is a broad scope. You can do the more community activities, and often the more traditional societies in Africa and so on, they have their resilience mechanisms, the churches and the community groups, and they play a very important role. And that's why we try to work with them also to reinforce them, even to learn. I think we are also learning from, it's not only one way. Often when providing aid, you also learn and try to do things better. But then, that's one side of the scope of mental health and psychosocial services, as it's called in MHPSS in our jargon. So we can go from a more community approach to the psychiatric services for people with psychosis or other. And that's another aspect also. Those people with major psychiatric disorders, when a crisis happens, they're not looked at often, they're forgotten, and they really, you will find them strolling around and being forgotten. So with a high risk of death then, because they don't know how to access services and so on. So it's it's one of our priorities in humanitarian aid. It's mental health, aside from sexual and reproductive health, where you have also very specific issues with a lot of sexual violence in humanitarian settings. That continues to be a reality that's difficult to bear, that the unwanted pregnancies, with all the consequences. And But then also, pregnancies, people not knowing where to go for deliveries, the conditions, health facilities that were destroyed, that were attacked, that were flooded or whatever. How to do a delivery? Then you have to do it in inhumane conditions, and so maternal mortality remains a big issue in many of our the countries and settings where we work. And also there, the human resource factor remains important, and the lack of qualified human resources.
Yeah, I imagine. Yeah, there are a lot of fronts to act on and limited resources to do so. So it's a big challenge.
That's where we need solidarity.
Yeah. Ian, thank you so much. This has been frankly, a very fascinating conversation about this topic on which I didn't know that much, I must confess. I like to end these interviews asking the guests whether there's anything I didn't ask, and in this case, you wanted to say. There's one topic we only slightly covered, I think, which is looking at the future. I think you made a lot of remarks that I think are related to that in terms of what the EU used to do in the past and what it's doing now, and the overall trends in humanitarian needs with which we opened our conversation. But what's your perspective, like looking to the future? What's your perspective in terms of the challenge side, so the size of humanitarian emergencies, also question marks, trends, what we can expect from EU humanitarian aid looking into the future? I don't know, whatever you want to say.
Well, yeah, as I said in the beginning, the trends are not looking good. The widening gap between needs and available resources, that's something that the humanitarian system is looking at and trying to solve through a more efficient response. I mentioned already, for instance, for some of the sectors or some of the needs people have, for instance, the food security, that will go more in a cash, which can be more efficient. But as said before, it's not for all needs and sectors and so on, education and health, and their quality and capacities to respond need to be maintained, and if not to be beefed up, to assure a life-saving action. And then, the known challenges, it is this non-respect of the international humanitarian law, and it's not only Africa or not only non-state armed groups, it's also the state armed groups, and so something has gone wrong, as we are seeing daily in the news of that. So how to correct that? Well, that's a big issue, I think. But then, I think doing more with same resources. There is also there was the grand bargain. It was a huge meeting going on for several days and prepared for months. There was the issue of more localization of aid. So beefing up the capacities to provide services and to provide assistance by local NGOs or by local emergency medical teams or other, and that's something that's the humanitarian world is really serious about, but it's difficult. It remains difficult because you don't train a doctor in 2 weeks, as to say. And then, I think what we are more and more looking at is also, aside from the localization, is the preparedness and the anticipatory approaches that's specifically more for the natural disasters, the flooding, the earthquakes, but not only. It's also when there are complex crises, there are often flare-ups of violence, and how can you better anticipate? Because each time having to restart from scratch a response, it's also not the best, most efficient way. So we need to look also in how can development do more, what we call the nexus. It's also quite humanitarian development language thing.
You can do more with the same funding ultimately.
It's to bring in also to make sure that there is some mind shift in development, in the development world, with the development actors, to be less reluctant to go into fragile and conflict affected settings, and which has been going on for years. And many of the development actors and the global health initiatives, they're working also now in these conflict settings and try to see how they can adapt and be more flexible. And so, but there, I think ECOWAS also and all the humanitarian actors, that we have to see how can we assist those development actors and budget fundings, which are much more massive than humanitarian funding. How can they better survive in some way whenever there is a crisis, to see how we can do things together, providing assistance in these settings. And also, I think there is still need for more evidence and more data-driven approaches. I think that's also something that, because we are sometimes we have a little bit difficult seeing the real impact also. And that's somewhere classical, I would say, for humanitarian aid, but we should not just say and accept it as such, but we have to do also efforts to use modern means, digital means, and so on, to make sure that we do the things the best possible way, in the most efficient way.
Yeah, a lot of what you mentioned has to do with planning ultimately, and the fact that so many times you have to fight an emergency means that in the end you don't have time to plan.
Yeah,
and that in a sense goes with it. But if you're able to,
you have to
you in general. So yeah,
life saving
people
first. It's the humanitarian imperative, as we call it. If something bad happens, well, we have to make sure that we can save as much lives as possible.
Yeah, I like in these situations the distinction between the urgent and the important. Those situations are urgent, but it's also important to plan to do it better next time.
Then you have the urgent and the less important. And where is the line between those different things, indeed?
Yeah, indeed. Ian, thank you. It was a great conversation, and keep the good work in Dakar.
Thank you very much, Jose. It was a pleasure too.
Este episódio foi editado por Hugo Oliveira. Contribua para a continuidade e crescimento deste projeto no site 45grauspodcast.com. Selecione a opção Apoiar para ver como contribuir, diretamente ou através do Patreon, bem como os benefícios associados a cada modalidade.